Hi, Dr. Brooke. It's our honor to have you here as a keynote speaker at Philly Cell and Gene Therapy, and it's a very inspiring talk. You give us your insight on the one disease at a time changing to many diseases at a time. So that's very inspiring. And so I have a few questions for you. My first question is, what made you decide to join us as a speaker? What brings you here?
Well, Hai Chen invited me, and I've met her at a lot of rare disease meetings, and I know there's a lot of interest in gene and cell therapy here in Philadelphia, and particularly we're just across the street from CHOP, and it's a very exciting place to come and talk about these issues, and I really appreciate all the questions that we got.
Yeah,
that's nice.
Is. Okay, so like from NIH perspective, how do you collaborate with academia, industry, and all the other stakeholders in this cell and gene therapy to advance the field?
Well, I mean, we fund a lot of academic investigators. Some of the funding mechanisms that we use allow us to sort of act as collaborators. They're called cooperative agreements. And then with the Bespoke Gene Therapy Consortium, we are working directly with industry in that program, and also FDA, and we're all focused on ways to streamline the way people navigate the regulatory process. And we're able to do that because all the diseases we're studying in there are diseases of no commercial interest, so that allows everybody to work together in a very collaborative way, and it's been a very enjoyable experience.
Yeah, it definitely is. So my last question for you is, what are the most exciting trends you are seeing in this cell and gene therapy field, and what are the challenges facing the implementation and the development of CGT from your perspective?
I think the development of new genome editing technologies is happening so fast. I think the development of the base editors and the prime editors from David Liu's lab was really exciting, but now seeing how quickly that's moving forward, but at the same time realizing that to get to the clinic we sort of have to pick one that we're going to go with, and in many cases that may not be the newest and most exciting, but to go through the regulatory process at some point you have to make a choice and kind of stick with that. So I think that's both a challenge but also an opportunity. And I think the fact that the FDA is now working on thinking about ways to designate and ultimately approve therapeutic platforms is one of the most exciting things that I've seen from a regulatory perspective. And a lot of the things that we're funding in our programs, and particularly the somatic cell genome editing program from the Common Fund, I think is very well aligned with that effort. And of course, that's a lot of what I talked about today. And I think that's really where the field has to go.
Yeah, that's very brilliant. Even though it's a challenge, it's also like provides us opportunity to provide more chances for other patients to get treated.
Yeah. Because I think there's so many different diseases. If we do them all one at a time, many of them just will not get treated, and we could have tremendous benefit on some of those diseases. So we just have to do it differently, and that's a lot of what we're trying to do with these programs, and it's really exciting to see the way the FDA is coming around and starting to think about the same things.
Yeah, that's brilliant. Thank you very much, Dr. Brooke. Yeah.
Thank you very much for the opportunity.
Yeah, hope to see you again at our conferences later.
That would be great.
For the future. Thank you.